My name is Katinka de Balogh, and I'm a veterinarian with a veterinary public health background and have worked for over 20 years with FAO, another international organization, and I have a special interest in rabies. So this webinar is part of a series of rabies webinars organized by the United Against Rabies Forum. And you can find more information on UAR in the chat. And I think, Rachel, you will be providing a link to the UAR in the chat for those that are not familiar. So today we will have a 1.5 hour seminar, and we will start with 2 brief presentations, which will be followed by a panel discussion. And just as a reminder, there are both options you can find on the bottom of your screen. There is the chat and there is a question and answer section. You can use the chat if you would like to introduce yourself and to the rest of the audience. And if you have any specific questions for the speakers or any comments, please use the question and answer box, because the speakers will be able to answer to your questions also online during the webinar. And if we have a little bit more time, we could also possibly answer them or discuss them in the discussion section. So for the first presenter, it's my great pleasure to introduce to you the first speaker, Dr. Gregorio Torres. He is the head of the science department at the World Organization for Animal Health, and he's going to present us today on the National Strategic Plan template that was developed by the United Against Rabies Forum, and also the process of endorsement of these national strategic plans by the World Organization for Animal Health. So, Gregorio, please turn on your camera and the floor is yours.
Thank you very much, Katinka. I will try to share my screen. Here we are. I hope you see my screen now.
Yes, it's there. Yes, it's in presentation mode. Thank you.
Excellent. Thanks, Katinka. Thanks, United Against Rabies Forum for organizing this webinar, which I believe is the first of the series in 2024. So I hope we also have a good year on rabies. So take opportunity also to wish the very best to everybody. So today, I think we are going to discuss something extremely important. And when I was putting together some slides, I thought the first slide could easily be my conclusion. We need to move from pilot project to run pilots to really get something official endorsed. We will not be able to progress with the speed we want if we don't really obtain and structure and think strategically in how we want to really eliminate rabies in our countries. And that was really captured and clearly captured when we published the global strategic plan that is very familiar to everybody, that we really think the strong foundation of any rabies elimination program is to have sustainable national elimination plan that need to follow One Health approach. And that was basically the foundation. That is the starting point of having a really pave to eliminate rabies. Building on that, United Against Rabies Forum, the experts stood together, talking to the membership. It was clear that countries require some guidance. They wanted to have a little bit of a guidance how to build this national strategic plan. And this is the slides and the cover that you see here on the screen. I put you a QR code so you can download this template, and I'm pretty sure Rachel and colleagues will provide also in the chat. But it was clearly, and that's the template, try to address strategically the biggest challenge that countries might face when start planning a national plan. So this template is a very generic template, but definitely it's a good starting point if you wish to review or you want to update or starting to draft a national strategic plan in your country. The document is available in the United Against Rabies website, and so far it's in English and French in translation. But if you require different language, please let us know, and we will try our very best to make this translation available as well. A good starting point is to also assess where you are. What are the gaps and the strengths of your country in order to eliminate rabies? And I brought you 3 tools that most of you are already familiar with it, but I thought it was worth to mention. And also, I know my colleague Andre is going to talk about that later on. It's the stepwise approach for rabies elimination, where these tools will help the country to assess the level of progress. The performance of veterinary services specific for rabies, that was a tool that it was created in Goa a couple of years ago. And the objective is to help the countries to assess the capacity of veterinary services to work on rabies activities. At the National Breeding Workshop, specific for rabies, again, most of you might have already involved in this kind of activities, but it was this tool is also tailored to rabies. And the outcome of this tool will be to assess the capacity of your country to eliminate rabies following the One Health approach. So it will establish a conversation between the veterinary services and public health services and try to create a roadmap so the countries can progress in the implementation of the National Strategic Plan to eliminate rabies. But we also got some more specific tools, again, that they are available in the United Against Rabies website, where there are specific tools that is going to help you to technically progress and implement some of the aspect of your national strategic plan. Go from planning of the vaccination, the cost, and there is a couple of quite a few templates as well. And all of this tool has already been validated, has been created by United Against Rabies and validated for the expert. And again, they are available in the website, but not only available. The expertise that is gathered in the forum is also already available to provide support. And I want to make reference to the 13 reference lab that they are rabies reference lab from Goa, but also the number of WHO collaborating center and FAO collaborating center that we got international expert ready, available to provide support if you require. But even when we know it's so important, let's try to see some data that we got. I got this statistic in December last year, and the global strategic plan. It got 3 different phases, starting from 18 to 2020. Now we are in the middle of the phase 2, which is 2021, 2025, and in 2026 we'll start the final phase, hopefully that will allow us to reach the goal. So far, we got 19 countries with national strategic plan. 2 of them has been officially endorsed by Goa. We got 26 in phase 2, which 8 of them are still on draft mode, and 1 has been endorsed by Goa. And then phase 3 we will see, but I would really like to see this statistic going on. But what I mean with Goa endorsement, in 2020, we, from the World Organization for Animal Health, we create a process where we allow countries to submit the national strategic plan to be formally endorsed by the General Assembly. And this is unique for a zoonotic disease such as rabies, where the countries can submit this national strategic plan, can specify the target, the budget associated, and also some indicators that is going to help the countries to assess progress. This dossier is being evaluated by the WA experts, and if it's endorsed, it's a quality assurance of the capacity of the quality of your program to be implemented and to really reach the goal of 0 by 30. It's also an evidence of the commitment of your country to eliminate rabies, that by submitting annual reconfirmation, this commitment is evident to everybody and will help also to convince other decision maker and probably investor to invest at national and international level, because there is a solid program and strategic plan that is helping you to achieve the final goal. Again, more information is available in the web, so I will not get into more details, but this is a process that is already in place, and I invite the participant of this webinar to contact me, and I'm happy to further explain how this works. So far, we got, as I said, 3 countries that they got the National Strategic Plan endorsed. We got Namibia, the Philippines, that it was in 2021, and we got Zambia, that it was endorsed last year. And I think we got our colleague Linos here with us today in the webinar. And I brought you this photo with the delegate from the country proudly received this certification from the president of the assembly and also from the UA director general. And more information again in the QR code if you want to see or to read more about how Zambia progressed and obtained this endorsement. But I know to get to this level to get the certification, the endorsement, there is quite a few missing links. There is quite a few challenges that we need to realize and we need to be aware and recognize and then overcome. Political will, make the case for investment to mobilize resources, and of course to have the technical capacity to do so. And United Against Rabies Forum has been leading this effort to overcome this challenge. The political will, thanks to the forum, we managed to bring the 3 director general from WHO, from FAO, and from GOA to kick off the forum and to make this strong statement using rabies as a model for rabies elimination. And that is a way of mobilizing, advocating, and also to increase the political will. Case for investment, again, there is a lot of tools, they're already available, and we published this case for investment for rabies elimination that can help you to make this case to convince the policymaker. And as I mentioned, the technical capacity is already available to provide this support. And you might ask, where should I start? Well, different countries might have different level of progression, but the first point is to identify focal points. Who is going to be the ones responsible in the country to move things forward? And it doesn't necessarily need to be a person, but at least somebody from the veterinary services, somebody from the public health sector need to be identified as the point of contact where they can own and they can champion the drafting and the implementation of the National Strategic Plan. Identifying partner. Rabies, we know, is a team effort. So we need to identify who are the partner from the public and private sector in the country that can make a difference, can help you to progress with the National Strategic Plan and make this case. We need to bring evidence to convince decision makers that investing in rabies elimination is worth it. And of course, make use of the existing resources. The resources that they are available there will not make any sense if we are not receiving the appropriate ask. So please, through the United Against Rabies Forum, try to articulate the ask, and we will make sure that this ask is being asked to the right question. And again, it's not for the international community to draft or to implement, but I think the United Against Rabies Forum and webinar like the one we are all participating today is ready available to provide you as an individual and also your country with all the support you need to draft and implement this very much needed National Strategic Plan. Because as we said, if we really want to get rid of rabies, we need to think strategically, and put that in a document it's essential. Katinka, and with that, I will finish my presentation, and I'm really looking forward for the discussion. Thank you very much.
Okay, thank you very much, Gregorio. Yes, it's very impressive to see, all the different tools and aids that have been developed to help countries to develop their national strategic plans. I think it's very important now for the countries to actually start implementing and starting using these tools. It's great to see here already participants. We have participants from Brazil, from Tunisia, South Africa, Ghana. So it's a very, many of you are country-based, and I think it's very important to get from you also what your needs are and how the United Against Rabies can further help you with progressing with your campaigns, with your rabies strategies, and an eventual elimination of dog-transmitted rabies. We have set the target by 2030, so time is running out, and there is still a lot of work to do. So it's my pleasure now to announce the second speaker and to introduce Dr. André Coetzer. He is the technical director of the Global Alliance for Rabies Control, and he will present us more on the United Against Rabies roadmap. André, great to see you. Over to you, please.
Thank you so much, Katinka. Can I confirm, is my presentation visible?
It's visible and in presentation mode. Thank you.
Thank you so much. And good afternoon, colleagues. And thank you, Gregorio, for the initial presentation today. I think it leads up to my presentation very well. So once again, good afternoon, everybody. And thank you so much for attending today's session. We want to talk about the value of national strategic plans and measuring progress towards rabies elimination. And I've placed on the slide here a diagram that's taken from the Global Strategic Plan itself. And what is important to highlight is that the Global Strategic Plan relies on a country-centric approach, which means countries need to lead their rabies elimination efforts. And a critical element to this is having national strategic plans available, a template that outlines how the government is going to actually address the issue of rabies control and elimination in the country. But I want to argue that having the national strategic plan is only the beginning. Because once we have a national strategic plan, those that need to implement it, the governments, still need to have a way to monitor their progress as the strategic plan is implemented, and also plan the activities that need to be addressed. And this essentially boils down to the adage of what gets measured gets improved. And if we have a national strategic plan and nothing more, no active implementation, there will be no advancement in rabies control efforts. And this is where the stepwise approach towards rabies elimination comes in. And Gregorio briefly mentioned this in his previous talk, but the SARE, or stepwise approach towards rabies elimination, is a tool that allows the monitoring of the National Strategic Plan implementation. And in essence, for those of you who are not familiar, the SARE is a One Health monitoring and evaluation tool that relies on a multi-sectoral workshop during which the rabies control program itself, the granular details of the program, is developed and refined. And to do that, the SARE relies on a two-step process within these multi-sectoral workshops. In the first step, the users, the participants, the stakeholders from the government assess their own rabies control elimination program strengths and weaknesses. And based on that, the SARE assists with the development of a customized rabies elimination work plan. This in itself is a very simple process. And I've tried to explain it very briefly in a little diagram on the screen, starting with the SARE assessment. The output provided to the users includes a list of all the pending activities, things that still need to be accomplished, as well as a SARE score. And we'll talk about the SARE score. But first, I want to focus on the fact that after a SARE assessment, a country is provided with a generic work plan, which is refined and adapted to become country-specific, and this feeds into the National Strategic Plan, where the National Strategic Plan provides the overarching objectives of the government. The work plan provides the details of how this will be accomplished. And we perpetually urge governments that a SARE assessment and the measurement of the National Strategic Plan implementation is not a once-off process, it's a repetitive process. And by undertaking these workshops, governments can not only align their efforts with the Global Strategic Plan itself, but they can develop these work plans that supplement their national strategic plans. And this is certainly not a new approach. The SARE assessment in these workshops have been done in more than 40 rabies endemic countries around the world, and some of them have actually done repeat assessments to actually measure that progress. But what is important is also that countries need to define the overall capacity to eliminate rabies and to measure their progress against. And that's where the rabies roadmap comes in. And I'm sure that Rachel and the meeting organizers will share a link to the rabies roadmap on the United Against Rabies website. But in essence, this is not another tool. This is not one more tool within the toolbox. This is simply a guidance to rabies endemic countries that allows them to measure their progress towards rabies elimination. And it's all centered around this diagram on the screen, which essentially explains that a country would undertake a SARE assessment, multi-sectoral workshop, and based on that assessment, they receive a SARE score, an overarching score for their government's rabies control program that equates to an overarching capacity to control rabies as outlined here. Through the then implementation of the work plan that feeds into the National Strategic Plan, progress is made, progress is measured through repeat SARE assessments, and in so doing, as the SARE score improves, the capacity to control rabies moves along this roadmap. So in essence, the roadmap is a support and guidance document or page for countries that provides the information at all stages towards rabies elimination. And these stages, these milestones, align with the WHO phases and the WOA criteria. So it is a synergistic guidance document. And most importantly, throughout the roadmap, revolving around the SARE and the work plan, users will find links to all of the tools and resources that are available and readily there to support the implementation of these national strategic plans. So in conclusion, apologies, more information on the rabies roadmap and the SARE tool can be found on the UAR website, and it truly provides all the information you need to know based on the roadmap, the SARE, and how it integrates these tools as well. And I urge everybody on this webinar to not only go look at this website, but also to share this information with colleagues who might be interested and benefit from this information. So thank you so much, and thank you for the opportunity to present today. Katinka, over to you.
Thank you very much, Andre. I think you have lined out very nicely this roadmap that countries can, engage with. And there is kind of the logical sequence on how to go about. As you mentioned, and also Gregorio mentioned, sometimes countries face the difficulties where to start. And I think here, the different tools can really help them out and find the logical sequence. I'm really pleased to see that there are so many participants from so many different parts of the world. And Andre, also when there are questions, possibly I will direct them to you, and maybe you can join us again after I introduce the 3 panel members and when we start the discussion for the others as well. So now I would like to pass it over to the panel discussion. I see Gregorio already has answered one of the questions in the Q&A, and there is another one pending. But our 3 panel members, first of all, I would like to introduce Dr. Madi Savadogo. He is a research scientist working for the National Research Institute of Health Sciences in Burkina Faso. And during the last 10 years, he has been working to build a One Health environment for rabies prevention and control in his country. And Madi is also the founder and coordinator of the Coordinator General of Rabies Free Burkina Faso. This is a civil society organization that has been very instrumental in promoting integrated approaches towards rabies elimination in your country. So in addition, you currently have a very high level, you are now in the part of the National Director of Animal Health for the Ministry of Agriculture, Animal and Halieutiques Resources in Burkina Faso. And I think this position also gives you the possibility to promote rabies control in your country. It's really great to see you here, Madi, and also you've been a very active member in the United Against Rabies. Let me now give also the opportunity to introduce the second panel member. And this is Dr. Pebi Purwo. We all know him as Dr. Pebi. He is a veterinarian in the Ministry of Agriculture of Indonesia with more than 20 years of experience in the control of animal and zoonotic diseases in Indonesia, but you have been also very active in coordinating One Health in Asia, and especially Southeast Asia. With your involvement in the National Rabies Program in Indonesia, you have been developing the integrated bite case management, as well as training modules for rabies vaccination team. Some of you might know the A teams that have been piloted in Bali, and I think now IBCM and also these teams are being also replicated in other parts of the world. So you have been working on also national communication strategies for zoonotic diseases and the One Health approach, as well as the One Health rabies map, roadmap for rabies elimination in Indonesia. I think also Indonesia has set 2030 for the elimination of dog-transmitted rabies. And you have been part of the Asian rabies elimination strategy. So I think here as champion of rabies control, not only in Asia, but even beyond, I'm very pleased to see you here as our panel member. And then we have our third participant, and it's a pleasure to introduce, I'm moving back to Africa, and this time to Southern Africa, in particular to Zambia, and introduce Dr. Linus Muzimbewe. He works in the Ministry of Fisheries and Livestock under the Department of Veterinary Services, and he is the Principal Veterinary Officer in the Veterinary Public Health Unit. So Dr. Linus, his role in the ministry includes undertaking risk assessments, inspections, and certifications, and he coordinates the prevention and control of zoonotic diseases, as well as involved in capacity development for the veterinary public health staff. As mentioned by Dr. Torres, Zambia is one of the first countries that has the accreditation of the national or endorsement of the national strategic plan by the World Organization for Animal Health. So I'm very pleased to have three very illustrious panel members, and I would like to go with my first question to Dr. Savadogo. Can you briefly elaborate on your experience of Burkina Faso with using the National Strategic Plan template? How did Burkina Faso facilitate its development, but also to secure further commitment and funding for rabies, as well as the SARE and the implementation of the National Strategic Plan? Over to you, please.
Thank you, Katinka.
Mute yourself.
Hope you hear me well.
Yes, we can hear you.
Okay, thank you. I would like to thank United Against Rabies for this opportunity, and also thank all the webinar participants for during this period. So regarding your question, I would like to start describing some phases of rabies control in Burkina Faso. I can say that in Burkina, we observed mainly 3 phases of rabies control. The first one, from 1960 to 2010. During this period, the country did not develop any planning document for rabies control. So the implementation of rabies prevention and control activity was conducted on case-by-case basis. Like the Ministry of Livestock handling only dog vaccination, animal rabies surveillance, or laboratory of the dog rabies. And when we consider the Ministry of Health, it only working on management of persons that are suspected to be infected, and also provide PEP for people bited by dogs. This is what I can characterize by, but as the first phase of rabies control in Burkina Faso. And the second phase, it runs between 2010 to 2022. And during this period, we can we have start planning some activity in the country, but it remains sectoral approach. Like we have at the Ministry of Health level, the national strategic plan for neglected tropical disease. This start in 2010, but it includes also rabies among the diseases targeted by the NSP. However, the NSP was developed and implemented only by the Ministry of Health sector, without the participation of other stakeholder or sector like Ministry of Livestock. So after implementing this NSP, we can observe that rabies activity that were planned in this were not active because of lack of awareness of many of people or stakeholders against regard. So the last phase that I would like to also to describe is what I can call the One Health Planning approach phase. So in 2000, in the country, by prioritizing some zoonotic diseases, including rabies as the second most priority one for the country. And in 2019, based on this presentation, the country developed and set the National One Health Coordination Platform. And during the meantime, we also have the opportunity that at the United Nations Against Rabies Forum, we will develop a template to support the countries for developing their own NSP. So as we get, we have the opportunity to have this template. It helps the country to organize one health approach for developing this NSP. So we conducted like individual discussing with all the stakeholders at the country level. And also we had the opportunity to organize meetings on stepwise approach for rabies elimination, evaluation workshops to identify all the relevant filters to be included in the at the country level. We had we organized a national meeting to validate this document to see how it can be what to say can be appropriated by all the stakeholders. So this is what I can resume as how having the strategic plan template help Burkina Faso to develop for the national for rabies control. Thank you.
Yes, thank you very much, Dr. Madi. And as you mentioned, initially it was mainly the Ministry of Health, but the importance of get all the stakeholders involved. And here often these stakeholder workshops can be instrumental when, you know, for example, the stepwise approach is developed or the national strategic plan. So to have all the different sectors involved, not only the government, but also here the private sectors. And as also was mentioned previously, communication, you know, World Rabies Day has been very instrumental in some countries to create this awareness and bring them all together, as well as Rabies Free Burkina Faso. This NGO has played a very catalytic role. So thank you very much. We will be coming back shortly with more questions. I would like to pass over the next question to Dr. Pebi. So we see from your experience, you have important global and regional experiences. So can you please share with us, on the one side, the rabies control in Indonesia, and how do you go about to ensure sustained implementation of rabies prevention and control, and also trying to prevent the reincursion of disease once in areas that have been free. Maybe you can share also some insights from this regarding regional strategies and specifically the Asian rabies elimination, the ASEAN rabies elimination strategy, where you have been instrumental in. Over to you, Dr. Pebi. Thank you.
Thank you, Dr. Katinka. Am I audible?
Yes, we can hear you clearly.
Okay, thank you. Good evening. Greeting from Indonesia. So first, I just would like to give some information concerning rabies in Indonesia and what is the control program that have been implemented here in Indonesia. So as in many other countries in the world, especially in ASEAN, Indonesia is endemic of rabies, and rabies can be found in most of the province in Indonesia. We have implemented a control program with some success story and also some best practices that we learn from the implementation. Indonesia has developed the national strategic plan. We have two documents. The first one is the master plan for rabies control program that is specific for rabies control for animal health side. And we also have agreed between the ministries to also develop the national One Health roadmap for rabies elimination by 2030. And in the past, we also implement some simulation exercise for a rabies control program in the free area. And to have a good implementation of rabies control program, we have developed several modules on how to conduct a rabies control program. And lastly, with regard to Indonesia, we do understand that one of the big issue in Indonesia is a roaming dog, the stray dog. So we also have completed a trial or the pilot project to see the implementation of using the oral rabies vaccine to assist in increasing the vaccination coverage in Indonesia, and the result is quite good and promising, and we will incorporate this result to our national strategic plan. And with regard to the ASEAN Rabies Elimination Strategy, or the ARES, I just would like to inform the webinar participant that this regional rabies elimination strategy, or the ARES, was first established in 2014 with the goal to eliminate rabies by 2020. And despite the considerable progress, rabies remain a significant public health issue in the region, in the ASEAN region, or in the Southeast Asia region. And right now, with the current situation and also the global target to eliminate dog-mediated human rabies by 2030, and also a growing momentum from One Health development in the ASEAN region, this provide momentum and also potential support to have to drive the implementation of ASEAN rabies elimination strategy in the ASEAN member state. And the availability of the regional strategies with the support from increasing availability of tools and resources that just mentioned by the previous speaker for rabies elimination from the global partners. This can also be utilized to strengthen and also to expedite the rabies control program and also elimination in the ASEAN. And the example of having the ASEAN rabies elimination strategy hopefully can become an example for others region to develop a regional strategy for rabies. And we also note that in ASEAN member state, all member states in principle agree that rabies elimination can be utilized as a model project for the ASEAN Leader Declaration on One Health, declared by all of our president or prime minister on May 2030. And how are we going to implement these strategies in the near future? As this is an ongoing process, the ASEAN Regional Coordination Network for rabies elimination will be established to assist in developing the annual action plan in the region, and also to monitor the progress of the implementation of rabies control program and elimination. This network will also will assist in formulating the coordination mechanism and also to strengthen the collaboration between member states and also with partners, enhance the regional rabies surveillance and also lab capacity, and also will try to explore the sustainable funding resource and also to build the capacity to all member states in ASEAN in controlling and finally eliminating rabies in the region. Back to you again, Dr. Katinka. Thank you.
Okay, thank you very much, Dr. Pebi. And thank you also for mentioning the oral rabies vaccination that is being piloted in Indonesia, the oral vaccination of dogs, where we hope we will get more information how this could also be implemented in the future as an add-on strategy beside the parental vaccination to have, especially for difficult to handle dogs, if that would be a new option. Clearly, we know that the oral rabies vaccination for dogs cannot, needs to be complementary to the other strategies. And there has been a webinar on this issue, and I don't know if Rachel, if you can share a link to that webinar. You have it? Okay. She has it here, so she will share the link to this specific issue. You mentioned the importance of ARES and for the region, and I think here also other regions could turn or take important lessons, like for example SADC, Southern Africa Development Cooperation, there the regional conference for the Southern Africa countries. They could also look into developing these kind of common strategies. As we know, the cross-border movement of dogs and of rabies and also of other animals could play an important role. And therefore, there is this need of these regional strategies to avoid the reintroduction of rabies into free areas. So I look very much forward now to hear from our third presenter, Dr. Linus Musimbe from Zambia. As we had mentioned previously, Zambia has had the experience with the endorsement of WOA's national strategic plan, of your strategic plan by WOA. And could you kindly share some experiences? I'm sure that also other countries would be very interested to learn how did you go about with developing this strategic plan, and then how did you go about the endorsement? And also if you can share any access to funding. I see there were some questions also about this specific issue. I would like to pass it over to you, Dr. Linus.
Thank you very much, Katinka, and thank you everyone for giving me this opportunity to highlight on the pathway, the way to achieving this important document endorsed. It has not been easy, and I think we started way back maybe sometime in the before 2019, trying to have the plan endorsed. To begin with, we were, of course, we had to follow the global trends by looking at the 0 by 30, and we're also encouraged to join 0 by 30, knowing that rabies is a very, very big problem in Zambia. We have rabies all over the country, reported in all the 10 provinces, and the source is still there, and we find that we're going to live with this problem for a long time if we don't do anything, looking at the way we're tackling rabies. And so we started looking at the plans on how to go about controlling it systematically. We had an attempt initially, and we failed at first. And of course, we had to go back to replan. The biggest input, we had to go by the stepwise approach towards rabies elimination, which assisted us in trying to gauge our stage where we are. So we used the SOIA process, and we assessed ourselves. Then later on, we consulted OA. At that time, it was popularly known as OIE, and we had to engage our local representation in Southern Africa. So we had a number of consultations back and forth. So we really had a lot of support. And at the same time, we were developing as a country, we're developing One Health national strategic plan. So with this, I think we also received goodwill in terms of political attention from the government, which gave us a lot of support to forge ahead in trying to come up with a strategic plan. We engaged One Health partners and also other development partners within the country who assisted us in a way. And through this One Health approach, as we were doing the One Health approach, we were also trying to also come up with a priority list, which we achieved last year. And within that priority list, rabies, fortunately, was one of the top 10 priority lists. So going by all these efforts, we find ourselves at a position that we were ready to really come up with a bankable document. Finally, when we now consulted OWA, and we said we were ready, so we submitted with all the support. And besides, we had also taken steps to do some priority, we had to pilot some of the aspects of the activities in the plans. With the support, for example, we're having a lot of support with the consortiums like International Rabies Task Force, where we are conducting on pilot basis the integrated bite case management, like what is obtaining also in Burkina Faso. So we are also doing that to test one of the activities in our plans, and we're also doing vaccinations on pilot basis. And there are a lot of good also from the private sector who are vets and vet clinics doing the private practice. We also contact them to see how we can put our efforts together so that we gather up this data and to see whether it can fit in the plan, so that at the end of the day, we don't only have the plan, but we have the output from the plan. So these are some of the things we've been doing in the background. And at the time when we submitted, of course, with OWA, there was a back and forth who advised, can you maybe refine this one, remove this one, can you provide this data, can you do this? So it was a lengthy process which took over 2 years, with one rejection and also refining the rejected document until last year that we were given this endorsement. So we are grateful that this has happened to Zambia, joining Namibia and others who are already, whose plans have been endorsed. And we hope that many more countries can also join, because having a plan which is endorsed gives, you have a system that is working towards certain targets. And you know very well that there will be annual reconfirmation coming. And some of these will be evaluated. It's not just having a plan, because a plan will be re-evaluated every year. And so there's every effort, even like right now, we are in the process of now coming up with the national budget has just been passed in Parliament, and now we are in the process of now implementation. So at the implementation stage, every time you have to remind everyone in the process that we have activities under this plan to be undertaken. So it gives everyone that momentum to go. We're also grateful to partners who have come on board to support, because after the announcement of the endorsement, we had a number of inquiries on the plan and how other partners would want to come and probably assist where we are lacking. In terms of financial resources, we know very well my country, Zambia, is not well positioned to have these resources available. It's a huge, huge challenge. Hence, we are also depending on goodwill from developing partners. And before the endorsement, it was quite difficult. But now with the endorsement of the plan, you find that it's easier to put up the plan and approach developing partners, and easier to point out where we are lacking and where we need assistance. And so we have USAID coming on board to assist us with funding for this year, where we shall have a lot of capacity building developed so that we improve on surveillance system. Already I've talked about the IBCM that it's being undertaken by IRT. We have CDC separate, of course, CDC and Mission Rabies are there in the consortium. We have the recently the US defense security coming in to support. In terms of vaccinations, we have a pledge that they will support us with the vaccines. And like I've already mentioned, the process of government budgeting is just underway, and the government has put up some resources to specifically, instead of waiting for outbreaks, we are already targeting to have as a in our vaccine bank to have already 100,000 doses ready for use where we can have outbreaks before campaigns, before vaccination campaigns. So that in itself shows that the strategic plan has brought out a number of issues that we can use so that we can have this plan executed properly. What needs to be done, especially for this year, is to make sure that what is in the plan is executed. Like what like the previous Dr. Torres, I think you mentioned that having a plan is another and executing it is another. So we need to be very careful that we really target to utilize the resources to maximum in order to achieve what is in the plan, so that we contribute to the 0 by 30 in the global concepts. So for now, I can also just indicate that also a discussion. The previous speakers also just talked about the oral vaccination, and a discussion with our Namibian counterpart. I think the director there, the discussion with him, that would also want to get in touch so that we can also bring in the aspect of this oral vaccination so that we can use, especially in the case where we have a number of stray dogs. So these are some of the things, although they are not, it's not in the plan, but we can refine some of these things and include aspects that are coming on board. Whatever the case that comes in, whatever new innovation that comes in, everyone is welcome to contribute, and we appeal to everyone to also assist us. We are not experts. By having the plan endorsed doesn't mean that everything is fine with us, and it's now even more difficult to make sure that everything goes well with the plan. Thank you very much. Maybe I can take back to Katinka.
Yes, thank you very much, Linus. And just with what your last phrases, the National Strategic Plan, let's say, is one step. Then there will be still many steps to follow. So, but it's a good first step. We need to walk the wrong road towards rabies elimination, and absolutely the National Strategic Plan is key here. May I kindly ask Andre and Gregorio to also come into the panel discussion? And thank you very much for your questions already. I see some of them have already been answered. I see Hugh is just putting in also on the dog population management. She's putting some information there. There was also a question on the National Strategic Plan, if I'm not mistaken, from the Philippines. Gregorio, would you like to answer that question?
Sure, and that's probably also helping to put everything in the context. There was also a comment by Eli about the annual reconfirmation of the control program, and that's part of the official endorsement that we do in Goa. The countries required to submit the progress on an annual basis to maintain the endorsement, the recognition. If we fail to make the progress against the plan they have already started, then this endorsement will be withdrawn. And importantly, the endorsement of the program doesn't mean countries need to eliminate the disease from one year to another, which is the case of the Philippines. What is important is to demonstrate that there is a good understanding of the epidemiology of the disease, that there is intervention, and there is progress against a plan that has been strategically thought with all the stakeholders. So we are not expecting total elimination from one year by another, but there is an expectation of progressively improve the situation and providing this evidence annually to GUA. So outbreaks might still happen, but it's important that evidence are there to show that we are making some progress. So I try to respond to questions in one go, Katinka.
Okay, thank you very much. Yes, I see there are other questions coming in. There was also the question on the case studies and you know of examples of positive impact on the control strategies that have been implemented. I'm looking, well, on the United Against Rabies Forum. There are several examples and case studies, and maybe some of you still remember the Rabies Blueprint. The Rabies Blueprint also had many case studies, and currently the Rabies Blueprint is being transferred to the United Against Rabies website. I see also Dr. Thomas Müller is here, and Dr. Thomas Müller was very instrumental in developing the National Strategic Plan template here. I just want to acknowledge this because I think it's a very, very good tool to really help you to organize, you know, the different elements that need to be in a strategy. There has been also some questions on the financing, and Madi, maybe could you elaborate a little bit on the pandemic funds and how you went about that to get some money for rabies? I think that experience is very valuable. Over to you.
Okay, thank you. Regarding the financial issue, you know, we could have in our country's national strategic plan, but we cannot do anything. Cannot do anything in Burkina Faso, as we have developed this national NSP. So we are looking for funding to implement this strategic plan, and then we had the opportunity to participate to the call for proposal launched by the Pandemic Fund last year. So under the coordination of the One Health platform, we gather all the stakeholders to discuss about what we could include in this proposal. So we NSP, we bring it on the table to convince the stakeholder that as it is developed through One Health approach, it is important to finance this, to fund this strategic plan because would really strengthen the capacity of many sectors like Ministry of Livestock, Ministry of Health, and it is important, it is instrumental to implement this to see how we can reduce rabies prevalence in the country, even in dog. Proceed.
Oh, sorry, you're breaking away. Yeah, go ahead.
Sorry, my internet is not very well, but like, so we bring this NSP and include it in the proposal. And unfortunately, fortunately, we got the opportunity. Our proposal in Burkina Faso was accepted by plan that we will have like 250,000 US dollar finance the implementation of this strategic plan. So we are now working with the National One Health Coordination Committee and also with the FAO, because FAO is our implementing entity. So we are now discussing with these stakeholders to see how start the implementation on the field. So this is why I think that when we have a strategic plan. It can help really to mobilize resources for the countries. It is very important. Thank you.
Yes, thank you very much for this very concrete example of how you manage with the strategic plan to get funding through the pandemic fund. I think currently the second call is out for the pandemic fund. And one of the requirements is also to have this One Health coordination as part of the pandemic fund. So I think it's a good opportunity to see if maybe some of the funding could be channeled to rabies under this umbrella. Dr. Pebi, a question to you with regard to the experience in Indonesia and on the integrated bite case management that was very instrumental and piloted in Bali. Can you tell a little bit more? Maybe not everybody is familiar with the integrated bite case management and how it's important to integrate this also in a national strategic plan. Over to you.
Thank you, Dr. Katinka. With regard to the integrated bite cases management, in principle, this method is basically making sure that the animal health sector and the human health sector can communicate, coordinate, and collaborate in handling rabies cases. For example, we developed a mechanism when there is a bite cases report to the animal health, to the human health sector, to the primary care center, then the human health sector can also take note about that report and inform their counterpart in the animal health sector. So we developed this kind of a mechanism, and when the animal health sector receive that information, then the animal health sector will follow up that information, try to find the dog who is bitten the victim, and also will confirm concerning the animal health status, the rabies status, for to be exact, and based on the information from the animal health sector, then the human health sector can follow up what need to do with the patient, whether it's to continue with the post-exposure prophylaxis, or it can be stopped based on our regulation concerning the use of post-exposure prophylaxis. And right now, with the experience in Bali in implementing the IBCM, or the integrated bite cases management, we developed some kind of application called CZ. Basically, CZ is the information system integrated between the human health, animal health, and also the wildlife health. And right now, it's only covered for rabies, for the report for rabies, but it will be expand to other zoonotic disease. So these three sectors can actually communicate between each other if they found any cases triggered by human or by the animal or by the wildlife. And just to also add the information, with the wide range of population and also geographical area in Indonesia, we also right now try to piloted the community-based approach in rabies control, especially for the IBCM. So at the village level, we have people that has been trained to communicate to each other and also to report when they are dealing with rabies. So this community-based zoonotic cadre is actually assisting us in not just taking care of the integrated bite case management information, but also assisting us in the vaccination campaigns, to delivering the IEC material, information, education, and also communication material, as well as assisting us in estimating and calculating the number of dog population within their village. So again, it's growing, and we have developed the guidelines of how to use the integrated bite cases management, and now it's actually expanding not just in Bali but also to other provinces in Indonesia, especially the endemic area. Thank you.
Okay, thank you very much. And yes, I think the community-based control, this is really where there is a key to success. You need to get the communities involved. They are the ones that need to bring the dogs for vaccination and to collaborate also with reporting cases and helping to send in samples. Yeah, just an experience from Thailand where at some point they had Mr. and Mrs. Rabies in the communities, so that the community selected specific a man and a woman who could help them. They would get training, they would get a t-shirt with that they are recognized as kind of rabies champion. And I think there's still a lot of work to do more with the communities. Maybe, Andre, you might want to say a few words about World Rabies Day, where the Global Alliance has really been championing World Rabies Day and the experiences with that, how that can further help to promote and create awareness. Over to you, please.
Thank you so much, Katinka. As you rightfully mentioned, World Rabies Day is celebrated every year, and it truly is an opportunity for people around the world to raise awareness about the disease, but also we've seen that it's used quite often by governments to showcase elements of the national strategic plan, to promote that plan, to promote that strategy. And I think any platform that advocates for that national strategic plan and its successes and its programmatic impact is vital. Whether it's at the community level, at the national level, it is important to sell successes. And World Rabies Day certainly provides the ideal platform for those messages to reach a global audience, to not only inspire others, but also demonstrate that it can be done and there is value in the approach. Thanks.
Thank you, Andre. Linus, what question? Zambia is a landlocked country and has many borders, you know, Botswana, Namibia, Zimbabwe, let me see my geography, Malawi, DRC, Angola. So you have so many countries that are all endemic for rabies. Are there any kind of collaboration with any of the neighboring countries? Because, well, as you're fighting rabies and you're controlling rabies, you will need to get some kind of harmonization or communication with them to avoid the spread of rabies across borders. Are there any initiative or anything you would like to share on this? Over to you, please.
Thank you very much, Katinka, for that very, very important question. And yeah, a landlocked country surrounded by 8 countries, and we had a very recent, apart from rabies, which comes from Zambia to other countries, and also from other countries, the 8 countries also bring transmitting to Zambia. However, there are some, we have some committees, especially on the border posts in most important crossing points, where they do conduct regular meetings. And at SADC level, in fact, it was re-emphasized. We recently had a SADC meeting 2 months ago, and we raised the issue. It was also as a result of the outbreak we had on one of the zoonotic diseases called anthrax, which occurred between Zimbabwe and Zambia, and on one side, and also we had the other side between Malawi and Zambia, and we raised these issues, and we again record the issue of collaboration and coordination between countries, that it should be emphasized, because this disease, most of these diseases are transboundary, and we need to really coordinate. So what we agreed at SADC level is that we have to really emphasize on this collaboration and coordination between countries. So in my view, the next step we need to do, for example, if we are to revise these strategic plans, and for those that are still in the process of developing strategic plans with the assistance of you. So we are going to have a component of collaboration or even committees suggested in these national plans so that we have regular meetings. Nowadays, it's even easier. You don't need necessarily to travel physically. You can be having virtual meetings regularly, maybe quarterly or half a year, so that we review the rabies situation. And we also encourage our neighbors. Namibia is one country where we already, whose plan is endorsed together with Zambia. So it's easier to be on the same platform. I've already spoken to the director for the Namibian, and have plans also to make sure that we visit the Namibian and see what they are doing. And at such forum, this is where we can even discuss collaboration and coordination. It's very important.
Thank you very much for emphasizing that. And you see there was a question on the cross-border issue. Gregorio, can I pass it over to you to comment on the national strategic plans? And there was also a previous question there. Over to you, please.
Thanks, Katinka. I really enjoyed this discussion. I really congratulate our colleague to see how we can bring people together, because this is what we've been discussing. What is the role of NGOs? Where to start? And I think it's NSP, a National Strategic Plan, is not only just a document that belongs to the capital or to the government. No? Everybody needs to own and to try to understand what it means. It needs to be science-based. We need to try to bring evidence to make sure it sounds. And whatever we are proposing, whatever the strategy of the intervention we are proposing, are really based on the best knowledge we have on rabies. And we need to, and this is critical to lead to success, and to keep convincing our decision makers that rabies elimination is actually feasible with the tools that we have in place. And that is not only for official veterinarians or public health. I think everybody should play a role, and as our colleague Dinos mentioned, even our neighbor need to be part of this discussion. And something we haven't probably mentioned, Katinka will finish with that, is about the learning. National Strategic Plan is not only just a document, as Dr. Savadogo mentioned, we put together and that's it, it's done. We need to keep learning, need to keep improving, and whatever we think there is a change in the epidemiology of the disease or there is new evidence, we need to keep changing. And that is the reason why also Andre refers that we need to keep monitoring on a regular basis. It's a team effort. And when we got everything well placed, I still encourage countries to submit this plan to OA to get an international recognition of the national effort. And that will leverage, as been mentioned here, more interest. We will do our very best to keep supporting, and probably it's the way to, break this vicious cycle of neglected. So we need to bring more evidence, more interest. By doing that, we'll bring more investment, and probably we will get there by 2030. So it's just the starting point, but I think it's important to ensure that the document that we are discussing today is actually integrating the knowledge, but also all the key actors in the country. Thanks, Katinka.
Yes, thank you. Thank you, Gregorio. Well, this webinar, the time is always too short. I think 1.5 hours, but I'm sure many people have other commitments, but I'm still happy to see so many that are actively participating and putting forward their questions. I want to start winding up slowly this webinar. So please, if you still have any questions, please put them in. We will share you can always contact the Global Rabies Coordinator for any questions, and Rachel Titman will be happy to also direct the question to the experts that are here, but maybe also to, when the questions are outside of this topic, also to other experts. I see the email is in the chat at the moment. I think the discussion was very rich, and I really would like to thank the presenters and the panel members for sharing their experiences and insights. There was one question also just now, that why it's mostly the veterinary sector that is more active in rabies control, and the human health sector is often lacking behind. Unfortunately, we see you know, that is often the case with One Health, that it's more driven by the veterinary sector. But if we look at the learnings from Latin America, where it was actually the human health sector that was driving rabies control, and they even funded the dog rabies vaccination. I see we have one participant from Brazil, and Brazil has been very successful in eliminating dog-mediated rabies. At the moment, you know, the problem remains in bat rabies in Latin America. But with regard to dog rabies, the whole continent, most countries have made incredible success. And now it will be the challenge to maintain it, as it has been more driven by the human health side. If there are no more human cases, often the funding will, you know, gradually disappear. So this is where the veterinary side needs to step in. I think in Africa and Asia, it is more the veterinary side that is driving, but we need to get the human health side involved. And I think here the stakeholder meetings are extremely important, but also to have good surveillance data. I think here, you know, as long as you need to demonstrate that rabies is a problem and it can be controlled, and that actually it's with regard to the Sustainable Development Goals, you know, it is an indicator for progress. You know, if you're able to eliminate rabies, you are really moving the Sustainable Development Goals forward, because it's very much a disease of poverty. And here, therefore, as was mentioned, involving the communities. Beside the policymakers, we also need to engage the communities and to work also across the borders, as was mentioned. Well, there are many points further that I'm sure you're taking with you from this discussion. But if you have any further queries or need advice and technical support, please contact Rachel, our Global Rabies Coordinator. And we will continue this series of webinars throughout the year. So please keep an eye on the United Against Rabies website and sign up for the newsletters. Then you will get regularly the updates, as well on the social media channel. I don't know if we can put some of the social media channels here as well. And if you have any topics for webinars, you know, we look very much forward to hear from you. The forum is really your forum, so please feel free to make use of it. The National Strategic Plan template and the United Against Rabies roadmap were presented today, and they're available also on the website, and you have seen the links in the chat. And we also would like to know if you are able to use the National Strategic Plan templates and your experiences with it, because we always try to improve wherever possible, and please share your experiences. Then I would like, as a final part, to pass over to Rachel with regard to the photo competition. Can you please unmute yourself and we can spotlight Rachel. Rachel, over to you.
Thank you, Katinka. I'm just going to share my screen here. So it's a big thank you to the very many people that submitted their photos. We had a huge amount of interest, and I think it was really exciting to see some work on the ground from people and all the things going on. So you gave us a lot of work for our judges. We had a judging panel to narrow those photo options down, and then it went to public voting. And it was really exciting when we opened that public voting up to see how many people were really keen and engaged to be supporting those people and to vote for them. So I will come over to this presentation. Can I confirm, Katinka, that you can see that okay?
Yes, I can see it. It's in presentation.
Perfect. So our first category, so we had regional prizes initially. We had 2 prizes for Africa because we had so many submissions from there. I'm very excited to say that our first winner from Africa is Daniel Waturu from Kenya. This beautiful photo here. And then we have our second winner from Africa was Nadeshla Petrus from Namibia. Apologies if I'm pronouncing anyone's names incorrectly. But these are our two winners from Africa with a huge amount of votes. So I think there was a lot of sharing on social media and a lot of excitement about these photos as well. So some really lovely photos, and it gives us a lot of content to use for a lot of our social media posts and communication posts as well. From the Americas, we also had some lovely photos. Happy to say that Rolando Rojas Garcia, I think, is also online with the webinar today from Chile. He is our winner from the Americas. So congratulations, Rolando. And thank you to everyone voting for this one as well. Moving on to Asia and the Pacific, we had an enormous amount of voting going on for our categories in this section. Our regional winner is Anup from India with this really lovely photo. So congratulations again. It was a very tough contest for some of those photos and not really a lot of votes between them, but this is the one that took it for Asia and the Pacific. Finally, for Europe, our regional winner for Europe was Luca Botman from the Netherlands with this really lovely photo. And I should say that a lot of these photographers also put in quite a number of photos, and even just picking between the ones from their own submissions was very difficult to do. And then very finally, our global winner with an overwhelming number of votes. So I think they really shared with their networks and on social media. So a very big congratulations to Manish Saxena from India as well with this photograph here of all these amazing school kids. So congratulations to all of you. Thank you so much, both to our winners and to everyone else for submitting your photos and the enormous support that we had from everyone voting. It's been really exciting to follow that through and to see people sharing that and voting online. We will be having another photo competition later this year, so we will keep you posted. And as per the competition rules, these are going to be photos that we keep online, we use in communications and things. We'll be in touch with the winners shortly with more details of those prizes. So back to you, Katinka, and thank you very much.
Well, thank you very much. Beautiful pictures and great congratulations to all the submissions. Really fantastic. And hopefully also you continue submitting. I think, you know, having pictures can say much more than 1,000 words. So to share think about when you go to the field, make pictures, please share them with us. And I think this can give a face to what's happening on the ground. So I see time is up, and I would very much thank our panel members and presenters. Thank you so much. Thank you so much, all the participants, for all your questions and participation. And also thank you very much behind the scenes, Rachel and Shu, for keeping all us posted and all the information you shared and organizing this webinar. And hope to see you in the next webinars and at next opportunities. And wishing you a great day, and let's make rabies elimination happen. We have just 6 years to go. So there is a lot of work. Thank you so much. Take care. Bye-bye.